Hi, I'm Gordon Kelly, and welcome back to our second part on our special on sleep apnea. And my friend, Reverend Dr. James Ornikian, is going to demonstrate. Did I get it right, James?
You got it right.
Oh, good. Is going to demonstrate our AH meter for our sleep apnea, and the AH, Bill, is the
Apnea Hypopnea Index.
Apnea. And Bill, this is readily available in your office?
Yes, it is.
And if you'd like the viewers to come down?
Yes, we do a free screening, and this is important because Dr. James here, like we mentioned in the first part of the program, he has a personal vested interest in this because it is really a tribute to his late great dad, Nick Onikian, and it is our mission to educate people so that they don't have the same issues that generations ago we saw, which were undiagnosed. So this is going to be a very enlightening segment in the program.
Bill, would you give your contact, your email?
Yes.
Or
It's the phone number is 718-428-2780, and the contact email is drAkpinar, AKPINAR, at AOL.com.
And Bill, where's it? You're simply easily located
In Douglaston.
right off Marathon Parkway,
Yes.
off the Grand Central.
Yes.
Walk by, take the train,
Walk by,
the bus,
drive by, fly by, get a camel. You're all welcome.
James, whenever you're ready, would you?
So, yeah, I'd like to show how simple and easy it is to just get a quick screening and do it live here. And Gordon has never done this, so we're going to just wing this here in front of you today and show you how simple it really is.
Now, Dr. James here has this item in his hand. It looks like a bong or a peace pipe, and it could be a trumpet or a trombone or something. But actually what this is a pharyngometer.
Correct.
And it is a highly sophisticated piece of machinery which, when this is placed in the mouth of the person blowing, will translate into a computerized pattern here which will show us whether there indeed exists a state of sleep apnea or it doesn't exist. So in the last program we showed you the standard, the baseline. So we're going to have a surprise. We don't know, Gordon. You may have it, you may not.
So the first breath that we're going to do two tests on this pharyngometry. The first one is going to be like his awake breath, where he'll inhale and exhale. He'll pinch his nose with his left hand, please.
All right.
You'll put this in your mouth, tongue under. That's simple. And just breathe out gentle. Breathe out. And now inhale, please. And exhale. Good. So clearly, already I can see there's very little apnea going on here because I've done it so many times with patients, and I can clearly see that there's very little obstruction. Will you please hit 2, Dr. Bill?
Yeah.
Number 2.
Sure.
Now on this one, we're looking for the collapsibility, as you mentioned, and the narrowing of his pharynx. And the way we do that is by extending the breath in, and it's a long, slow exhale. And at the end of the exhale, we'll notice if there's an issue. So let's try it again. So left hand closed, put it in. First breathe out so you get the air out. Breathe out, exhale, and now start your inhale. So he's inhaling, keep going, keep going, keep going.
Now we see that it's holding pretty consistent.
Keep going, and when you're ready, you start exhaling, Gordon. Just steady, just steady. There, he's back on track, steady. Keep going. Let me know by raising your right hand when you're almost out of air. Excellent, Gordon, excellent. Excellent, excellent. Keep going. Wow. Impressive. Wow.
Gordon, it looks like you don't qualify.
No collapse. I'm very sorry, Gordon. You don't have it.
You don't have it.
But James and
Yes,
Bill,
brother.
getting back to that AH scale, I'll grab that for you. On this AH scale,
Well done.
on somebody that would be, this would be that range of 10 to 15 you were discussing earlier on that index.
Right, on the index. And we're going
AH
to talk
index.
about how that translates into Henry's contraption and take-home sleep study. Yes. Now, if you look at your results here, Gordon.
Thank you, James.
Well done. Well done. You don't really qualify. You've got a pretty good pharynx. You sleep pretty well, obviously.
Sleep
this
well.
is right there. Right, this is the oral cavity and the naso and the oropharynx and the structures a little further down, and you see like almost a negligible drop. This is the baseline, and that's the drop. Now, when we see people who are severely apneic, you'll see this going down to that area, and instead of seeing like 79, 76%, you may see 60%, 50, 40%. Okay, so you may see such an incredible drop that it's blatant, it's glaring. So here, you're lucky, you're blessed, Gordon.
Children also, James and Bill?
Yes.
Yes.
Yes, we can do this on children. With children, you'll see mostly the kissing tonsils. You know, you look at the
Yes.
tonsils. If the tonsils are large, you know, that will be a potential cause of apnea. And one of the things with children, we should mention that a big part of the ADD, ADHD epidemic is from sleep apnea in children. This is very important. They put children on Ritalin and all these drugs, but if a child is not sleeping well, what's going to happen? Their hormone, their brain neurotransmitter harmony development is going to be impaired. What happens during the day? They're hyperactive. They fall asleep.
And then you add in poor diet, you add in sugar.
Inflammation.
You know, we talk about peanuts being bad for people with aflatoxins, wheat, gluten.
Yep.
It's becoming more and more known.
And not to get too far, but would that blow up the tonsils?
Yes.
Swelling them up.
Aflatoxin will do that.
Inflammation will do it.
And this is also connected, this meter is also connected with your friend Henry over here.
Yes.
Henry?
Would you like to go to some more of the slides, Bill?
Henry?
Where would you like
Good
to go?
man. Okay, now.
How's Henry breathing?
We translate from here onto Henry's domain. And what happens here, essentially, if we were to see a pretty big drop, like you wouldn't qualify to meet Henry, but the average person, well, I would say average, a good 40, 50% of people may have to avail themselves of this contraption here, which we're going to explain in a minute, because this will be a guide, a barometer, as to where we're going to go next. Now, where do we go next? We give the patient this Aries, what we call Aries device, the watermark, and I call this the headgear. And they actually put this on their head, and they sleep with it. Okay, it's a take-home test. Now, why are these tests more comfortable for the patient? Well, the alternative is to sleep in a sleep lab, and you're hooked up to a million different electrodes.
Right,
and
you're in the comfort of your own home.
You're in your own home.
And may I also say, this is pretty much a standard with people doing heart monitor, people doing blood pressure. They also have bring home devices like this.
Yeah.
So this is not out of the realm
This will
of
actually
normal, any
this will
normalcy.
tell us a lot about the oxygen levels of PSO2 and the disturbances. It's actually GPS acquired.
More and
It
more
tells you
people
which
using
side
this
you're
instead
on.
of sleep labs.
And the person is a board certified doctor that would look at these and investigate and analyze this. And these are board certified doctors in sleep, a doctor of sleep.
These are individuals who have done an additional length of training, a year or two in sleep apnea, in sleep medicine, and they interpret, like what happens is the patient will take this home, they'll wear it, and I think we might have a couple of graphs here that show a depiction of what goes on, the interpretation of this. This gets applied, and it's pretty comfortable. I wore it. We all kind of took our test, and it'll give you a snapshot of what goes on over a 5, 6, 7 hour period, 8 hours. Whoa, hold on, what's this? Oh, this is a friend I picked up in Jones Beach.
What kind of apparatus is that, Bill?
That's an anaconda. It's an anaconda, actually. Actually, that was in the Peruvian Amazon, and as you can see, my pharyngeal airways was being compressed. It took about another 3-4 seconds before I was strangled, and you don't see the two guys, but they pulled them off of me. It was like cold steel around my neck. That'll give you sleep apnea.
That's very illustrative. Very illustrative.
Yeah, it's part of my travels in the National Geographic Doctors Hall of Fame. I think we might have to go 1 or 2 slides forward, and we could see what happens when these things are applied. And this is what it looks like. You take it home, and it'll show you the airflow the pulse. I mean, this gives you a multitude of readings: oxygen saturation, snoring, position change, even like when you're turning right to left, movement, EEG, EOG, EMG. So really, it's giving you the electroencephalogram, how your brain waves are moving, how your skin resistance is, the snoring. And if we move on to one more slide.
Importantly, Doc, is that it tells us which part of the sleep, whether it's beta, alpha, delta,
Yes,
theta. It
very
shows
important.
us where they're getting the most.
You may want to go into that.
Yeah,
James.
hypopnea and apnea. So, and if that's the case, if it's in the middle, if it's in the early morning hours, then yeah, if you do practice, yoga, and you do follow the diet and the regimen, and you stay away from certain foods, you will lessen the frequent obstructions that happen.
Right, the apnea, hypopnea, absolutely. That's a very important point. So this will give you that, and I think maybe a couple of slides ahead, we see the interpretation of this.
Right.
There's a whole graphic, and these are the results. Maybe one more slide, right there.
Right.
Now this is a very significant slide, and this is what the sleep doctor looks at. We take this. This gets after the patient brings it back, hopefully, because it's a $5,000 piece of apparatus. So we give it to a patient. We're
not shower
praying,
with it.
right? We're praying that they bring it back. It's an honor system. We give it to the patient. They use it. It's a service that we do. They bring it back. We take a look at it and we say, okay, now this one has definitely got. They're in a 15, 20, 30 percentile. To prevent this person from going down the tube, let's send the data, upload it, send it to the sleep doctor, the sleep laboratory. They look at it. They record the number of AHI, the arousals, the RERA, what we call the arousals during sleep. And if you look at that graph again, you could see where it's circled. You see all the areas of snoring. You see the areas of the drop of oxygen, and that's what we're looking at. But notice at what point of the sleep cycle that's in.
The end.
There you
Early
go.
morning.
It's
early
right
morning.
in the REM cycle. So the REM cycle, the rapid eye movement region of your sleep, which is maybe in the 6th, 5th, 6th, 7th hour, depends on how much you sleep. Of course, if you don't sleep sufficiently, you're not going to get a lot of it. Where you dream, where you actually drop down into that flaccid state, that's where you're going to get the drop in oxygen. That's where you're going to get the apnea, the actual closure, and then they will say, yes, this person has apnea.
Is this where you're going to have sudden death, stroke, heart attack?
That is where 80%, 60, 70, 80% of strokes take place, heart attacks take place, gastric reflux and choking. They talk about GERD, gastroesophageal reflux disease. Things just don't come up. They come up because there's food in the stomach and there's a negative intrathoracic pressure. When you go into that apnea, the body's trying to breathe and you're sucking up the stomach contents, goes in, what happens? You choke.
We discussed in the previous program, but is that also related to insomnia? And you're talking about sleep.
Sure.
If you're having insomnia and you're not getting your good sleep, then you're going off into this. If you're not sleeping well, some of the reasons that we were talking about the insomnia were poor diet, dehydration, caffeine, overeating, exciting. Somebody's getting married.
End product is almost the same.
So now you're having insomnia, you're not being well rested.
Right.
But in those early morning hours sleep, many insomniacs only get an hour.
Yeah, this is much more severe, but the end products are very similar. You're not getting enough sleep. You're not getting the rest you need. The body is not getting the nitric oxide that it needs to replenish, rebuild the capillaries, the arteries, restore itself.
Those two hormones that we mentioned,
Leptin and ghrelin.
they're not being produced.
Right.
They're not being produced. And also with that little part of right on there with people having the sudden death.
That's when it takes place. Now, if you look at, there was a Darth Vader slide over there. We had this weird-looking contraption. What is the solution? Now, we're going to just, we're honored to have Dr. James here, who's going to go into some breathing techniques, which are really priceless. I mean, these are amazing because you will not get this anywhere else. You see the mask over there. Okay, now, a good 50% of people will not wear it. I mean, you get this, you hook it up, you've been diagnosed, okay. We've done the pharyngometer, you've met Henry, you've taken Henry's headgear home, you've done all this, and okay, you've got it. What's the solution now? What's the end product? Well, you've got this thing, which is a mouthpiece. Okay, so what we do here is we do a very, very detailed measurement where we take the jaw, and where the jaw moves and the position is perfect for mitigating or controlling, or let's say putting the pharynx into an ideal position where it doesn't collapse. We'll lock it in, take an impression, and make this appliance where the jaw during the middle of the night is
let me
locked
add to
in.
that, making that piece is a critical part of the whole device working, and we would do that together, him being a
Right.
DDS.
Right.
So we'll calibrate it with the pharyngometer. So we won't only just make
Very
it
complex.
You will rebreathe with the mold, or actually with what's called a jig. It's
With
a
what's
little
locked
piece
in into the ideal position.
in the ideal position, reblow, and we'll get you up to par.
And he'll do the measurements. Right? It's very critical.
And I would also like to add for the audience to know that Dr. Bill, as a doctor of dental surgery, is more than highly qualified in this cranial region of the skull
this
and the
is my
body.
specialty.
And I was not only I'm a friend, but I've also been a patient of yours. And I was in your office once, in which a man came in suffering for the longest time of a little TMJ, and I saw Dr. Bill miraculously, just in a short little, almost like a little adjustment, the man had instant relief of his problem, and he was telling everybody in the office as he was walking out, I'm a medical doctor, and I've never seen this, and I can't believe it. This was a medical doctor that I was in your office.
Yeah.
Bill is more than highly qualified in this specialty. Is that more or less a specialty of this cranial jaw TMJ area, and how vital it is?
Having treated so many patients with this craniofacial type of injury and pain, you notice that, you know, in addition to like the people that won't wear the CPAP, they go to this. Now, in order to take the impression, if the jaw is malaligned, if it's not in occlusion, if it's not right, we do a very specialized, what I've created, a form of craniosacral manipulation that sets it right. Sometimes we'll do PRP, stem cell injections, to hold it there, to repair the tissues, and those are a vital, vital part of the whole treatment. Acupuncture, trigger point injections, and then we'll take the impression. One of the problems is a lot of people take these impressions, but they take the impression with the jaw in its bad bite position, and they're reinforcing this bad bite, and in a year or two or three, now they got jaw problems, and that may require surgery or extensive therapy. So this is a real problem. So what do we have? We have Henry, we've got this contraption, or we've got the real ultimate non-conservative therapy, which is surgery. They realign, remove things forward, and then
Which is the last
resort. But we have a resort here that our good doctor will kind of describe now,
Let's get
which
into
is
it.
Sure.
at least an incredible adjunctive.
You know, it's one of these things where you don't have to move around. You don't need to be in the greatest shape in the world. You just have to spend some time on cultivating the proper inhalation and exhalation. Now, breathing with the throat muscles. This is the key. So you're going to make some sound when you inhale. So I'll make a little sound. You'll put your hand on your throat. You can give it a shot at home. Don't be embarrassed to make some noise. And okay, that funny noise in the beginning, you might be embarrassed. You might even cough immediately from it because it throws a lot of toxins out. But what's happening is right above your larynx, these pharyngometal muscles, the larynx is the voice box. So also, you're not only supporting sleep, you're supporting your voice during the day.
Yes.
You're supporting awake structures as well. But based on
Singers
sleep,
can benefit from this too.
you have a weak pharynx. It's collapsing at night. So wouldn't it make sense to put two strong muscles on the side to hold it up? And that's what this is doing. So after some time, you'd inhale, and then this is called Jalandhara lock, which in another program we'll get into. But by stimulating and by contracting this bandha, this lock, you're also strengthening. So you're strengthening the entire throat, basically the throat muscles, okay? And you would do this repeatedly over and over. Another very important part of breathing, which is the main breathing, if you ask somebody from India what yoga is, they'll tell you it's pranayama. They don't know about hot yoga and Raja yoga and hatha yoga. They do breathing exercises. So Kapalabhati is called skull shining pose. That's what it really means. But it's the remover of toxins. So we're used to doing crunches and pushing and twisting and doing all these things. This is sucking in the organs. So what do we have here, doctor? Liver, gallbladder, spleen, intestine, pancreas, stomach, uterus, bladder, sexual organs, and so on. Even kidney, adrenal. So all organs benefit. When you exhale, you're throwing the toxins out. So it takes a bit of practice to get this. You want to do it on an empty stomach. We did eat dinner tonight. So you want to sit upright and pull the abdominal wall in and breathe out. There's no inhaling. It's only exhale. Inhale is natural. It's like an accordion. It pushes out, it comes in. So, yeah, can you just do that while I talk? So he's pulling in, and only this abdominal region. What's in here? All our organs, all our problems start in the gut. So we're removing toxins. We're strengthening the diaphragm, and that strong diaphragm, even if you were choking, it would support you. So this can help you in a wake life as well.
Yeah.
Is it ideal in the morning?
It's ideal first thing in the morning on an empty stomach. It's a great active meditation. Yeah, before bed too, empty stomach, sure.
Or throughout the day also.
Twice a day,
And it
sure.
seems to me that you're almost, sounds funny, but massaging
Heart.
Exactly what you're doing, Gordon. Exactly what you're doing.
Massaging the heart.
What he gave you here is critical wisdom because it's massaging all the inner organs, it's strengthening, and let's assume there is a little bit of this. You will learn to control it with your breath and not let it go into the extreme mode.
And another thing I'd like to add is this also removes secretion in your lungs, in your ears, in your sinus cavity.
That breathing.
Right. So you remember, you're removing the thickness out of the body, the sludge in the lungs, in the blood. It gets the blood moving. You're pushing oxygen in, carbon dioxide out. So it makes simple sense. You're removing the garbage. Now, there's another breathing which harmonizes these, and it's called alternating breath. And I'm sure a lot of you heard it. The Indian name is Anulom Vilom, but it's alternating breath. You inhale from one side, you exhale from the other, inhale from that side, and exhale from the other. Continue for a second here, because he knows how to do it. So you're inhaling into the thorax, that's the upper organs, the heart and the lungs. You're not up to the diaphragm and out, so there's no belly breathing. Your stomach is pulled in a little, and you're expanding the lungs. So you're increasing the volume of oxygen that comes in, and it's very relaxing, even after a few breaths. So this is a great way.
I feel clarity.
Yeah, there's a clarity.
So there's a lot of other benefits, aiding in sugar regulation, a host of ailments. Okay, blockages in the heart, the compartments in the lungs. You know, by isolating them, there's a magic that happens. So those three breathings, I would say, are the main breathings. Kapalabhati, breathing out, pulling in the abdominal wall. The Ujjayi for the snoring and for the sleep apnea is critical. Hold for some time and then exhale through left.
For the sleep
and then the alternating breath. I mean, there's many breathings, but those, I would say, knowing what I know, they're the three main yoga breathings.
And James, with your contact number here, also up on the screen, as a naturopathic doctor, people can also contact you.
Sure.
You're in Bill's office.
You want to give the yoga studio contact info.
And also that would like to get people to come down to see Bill, to get on, and you, James, to get this test, the breathing, the AH index.
Right, as you saw how easy it is to find
how
out.
simple and easy.
I've been a student of James for 10 years in the yoga studio,
of his as well.
Yoga Oasis in Woodbury
Woodbury, New York.
Woodbury, New
So
York.
we've been there for 16 years, oldest running hot yoga studio on Long Island.
Most incredible system. He's created it.
We've taken systems that were out there and recreated them, and we actually conduct teacher trainings, which we teach other teachers how to teach. And we have a pretty great thing happening out there. We also have a studio in Hawaii, and Bahamas. We're creating studios all over and teaching more teachers how to spread this beautiful art form, which supports sleep, supports good, healthy lifestyle, and diet.
Yeah.
Because diet is a critical
part. Component of health.
Because even if you do the breathing, even if you get the apparatus, if you're eating at 10 o'clock at night,
sugary,
and you have an upset night, you're stressed, you know, everything gets thick. He can explain that better than myself. But when we get stressed, can you explain the cholesterol and how that thickens everything up, Doc?
It congeals everything, and the later you eat, the more dangerous, because remember, it takes about 6 hours for food to transit the digestive system, and they talk about this, the sages talk about first sleeping on the left and on the right, you know, based on the 2-hour cycles. When you sleep and the body is shutting down into the parasympathetic mode, you're not really digesting the way you should if the stomach is full. What happens? You go into this apneic mode, you're sucking everything out with a pH, gastric contents, a pH of 2. I mean, that'll eat right through this table. So
Yes.
imagine what it's doing to the esophagus.
So one really good point is that if you don't eat too late, you're pretty safe.
Yeah.
So if you don't
lessens
eat,
the risk,
right.
yes.
I mean, if you eat your last meal at 6 o'clock and you're going to bed at 11, you have 5 hours of an empty stomach. You drink some herbal teas and water, and you know, you flush it down. But if you eat an hour or 2 or 3 before and you have poor digestion, which most people have,
And
poor
apnea.
digestion, and on top of it,
You're
apnea,
asking for it.
you're asking for trouble, and it's something people need to become more aware of and not embarrassed about it.
Sort of a prescription would be
Not
the
to eat
breathing,
late.
the breathing exercises.
Sure. If you want
As
to do
opposed to
nothing
going
else,
into
Don't eat
high
late,
risk surgery,
don't eat
the
foods
cost,
that
the
cause
upset.
inflammation.
Bill, you're going to get surgery, or you're going to have to go into anesthesia.
Well, here's the options. You got Henry, you got the jaw plate, you got surgery, or maybe this, and maybe, you know,
maybe you do a little of all.
little
And I know, speaking to a lot of people who have sleep apnea, even my own sister or a family that I suggest they get tested, there's an embarrassment for it, and I think it has to end. You know, don't be embarrassed if you have an issue. Come get tested, and we'll
that's why we're
resolve
here,
it. And if you don't want to
present
wear
this
the
with
Darth
them.
Vader mask,
come-
because the CPAP machine is a full cure for sleep apnea, but a lot of people feel uncomfortable. You know, especially
wear
if you're
it.
single. You know, if
don't
you're
wanna wear it.
single and you invite your lady friend or your boyfriend over, and you know, you go, wait a minute. Hold on a second here.
I couldn't sleep
What,
all night.
what
I
is
kept
this?
snoring.
crouching and putting on
So,
your face.
so this bite plate is a beautiful resolve, really.
Yeah.
So,
A silent resolve.
so we would like to invite the audience
Sure,
to come over to Bill's office for a free screening.
definitely.
While they're there, they'd also see James, and we have your contact numbers, we have your information, and with the show on sleep apnea that we're just wrapping up right now with Reverend Dr. Bill Akbanar, Reverend Dr. James Onikian,
Very good, Gordon.
and I'm getting that, it's my breathing, I got it down with my breathing. But I cannot thank the two of you enough for coming in and demonstrating this. Before we wrap up, any other points or anything you'd like to make? We've got your contact information. Please come over and see Dr. Bill Akbanar. We can't invite you enough to come down there. It's a silent tragedy. We're going to wrap up the show right now, and I can't thank you enough.
Positive
Thank
thoughts.
you, Gordon. Thanks for
positive
having us.
action, positive outcome. Thank you very much.
Thank you very much.